Have you ever felt trapped in your own thoughts or stuck in a loop of behaviours you just can't seem to break? Today, we're breaking down one of the most proven forms of therapy in the world, CBT. What does CBT actually stand for? It stands for Cognitive Behavioural Therapy. Let's break that down.
So cognitive means to do with cognitions, which are your thinking type processes. I mean, anything to do with thinking type, could be memories, that could be abnormal thinking, for example, but it's that sort of area for cognitions. Behaviour is fairly obvious. It's behaviours that we all do. And therapy means therapy.
Right, but how might that work with a therapist?
You would start any therapy by establishing a relationship with the patient first. So that means listening, establishing rapport, reflecting what they're saying, summarizing, checking your understanding. If you can get into that relationship with the patient, then it might be possible to engage in a cognitive behavioural psychotherapy relationship with them.
In the early stages, it's about behavioural tasks, agreeing to something new.
Because you might have developed a sense of collaboration. So patients need to want to and be able to collaborate with you. Now that means that both the patient and the therapist are going to suggest what we might want to work on and try and collaborate and agree on a shared agenda or a sense of what you might work on together.
And here is the crucial part. There is absolutely no sense of failure. If it doesn't work, if you fail a task, think of it as data. And how can we modify this? What can we learn?
If the behavioural side of things tends to go well, you would move on to the cognitive elements of an illness. And that's difficult, but you can find ways to help patients if they can work in a collaborative way of not necessarily changing their thinking, but coping with their thoughts or dealing with them in a different way. And the full cognitive behavioural psychotherapy is when you try and link the cognitions and the behaviour together and understand these links. And patients can understand it for themselves and hopefully adjust something that will improve their lives.
This is a complicated explanation of a very deep and intricate therapy. If you want to learn more about how to map your own thoughts, hit subscribe and check out the links below for more information on the topic. Thank you for watching. Check out our other videos on Mental Health TV.